One of my colleagues was asked by a patient, Doctor, are all these scans really necessary? My friend said, think of it as an extensive internal photo shoot. A day will come when there will be an Instagram for these pics too. You can thank me then. We are probably just a few years away from Instascan, the only feed where your likes are based on your liver symmetry and gallbladder aesthetics. If you have gallstones, you can just Photoshop them out of the scans before you share them online. It is said that the art of radiology lies in knowing when to scan, what to scan for, and how to interpret what you see in the context of patient's story. Hi, I'm Gaurav and you're watching Gut Instincts. Today, let's find out the ways to diagnose gallbladder stones. Currently, we have got lots of scanning options, from simple X-rays to high-tech MRIs. Each is different and good for different things. It's very important to remember that different types of scans have their own way of seeing things inside us. So, the data these scans collect can be interpreted differently. This can be explained by looking at how DSLR or mirrorless camera lenses work. Various lenses are available to suit various needs. Larger telephoto lenses are for objects that are far away, like flying birds. It's like having a telescope for your camera. However, they capture only a small portion of the scene. Macro lenses magnify close-up objects like insects. Then we have wide-angle lenses, zoom lenses, prime lenses, and so on. Beginners often ask camera experts which lens is the best. And honestly, there is no right answer to this question. It all comes down to the photographer's needs. This also holds true for medical scans. All scans have relative strengths and weaknesses when compared to each other. Even fancy, pricey scanners can miss things that are sometimes obvious at first sight on a cheaper scanner with a different technology. Nowadays, people tend to think that more expensive scans are automatically better. Sometimes they are, sometimes they aren't. With this background, let's dive into the scans needed to diagnose gallbladder stones. Coming to the first scan, abdominal ultrasound. Ultrasound scanners use the same tech that bats use, Sonar. Both use high-pitched sounds to see the unseen by listening to the echoes. The superhero character Daredevil of Marvel Comics also uses this type of sonar system. Bat ultrasound is lower frequency, creating deeper sounds in air that carry better over long distances. But ultrasound scanners use significantly higher frequencies, which cannot travel much in air. Ultrasound doesn't work well on things filled with air. To scan an organ, the scanning probe must have a clear path without air or bone in between. Because the gallbladder is under the abdominal wall with no air-filled organs in front of it. It's perfect for finding gallstones. It's basically the gold standard for diagnosing gallstones. It does not produce the harmful X-ray radiation found in CT scans. Ultrasound finds even very small gallstones over 2 mm, more than 95% of the time. Moreover, it can detect early signs of gallbladder inflammation or infection. Many gallbladder stone complications are accurately diagnosable using ultrasound. However, there are some weaknesses of ultrasound. A complication of gallstones is the migration into the common bile duct. Ultrasound only detects about half of all the bile duct stones. This is due to the fact that there is the presence of air-filled portion of small intestine, duodenum, in front of lower portion of the common bile duct. Another drawback of ultrasound is its potential for bias. The radiologist's skill and judgment matters. Let's illustrate this concept with an example from the famous book, The 7 Habits of Highly Effective People. Look at this picture of a lady first. People may disagree on the lady's age in this picture. Most who first see this picture assume she is in her 20s. Most viewers seeing the other picture first perceive her age as approximately 80. However, if all these 3 pictures are seen together, we can interpret multiple perspectives. Ultrasound is also prone to such personal biases. Its results are based on live scan interpretation, also called real-time imaging. CT or MRI scans provide numerous image pictures in multiples of hundreds. This allows personal clinical assessment by other clinicians. Ultrasound scans do not give this liberty. There is no way to cross-check the information given in a report. It's common to get different opinions from different radiologists when things are not straightforward. Let's now discuss the advanced scans. CT scan. A CT scan stands for computed tomography scan. CT scan, just like regular X-rays, they use X-rays, a type of electromagnetic radiation. These high energy photons can go through lots of materials like the human body. A CT scan takes lots of pictures of your body from different angles. Then a computer uses these shadows to mathematically create a detailed picture of the body's insides. It provides an internal body view impossible with conventional X-rays. CT scan have revolutionized abdominal imaging. Modern advanced scanners offer incredible detail and clarity. In CT scans, the heavier an element, the more X-ray it absorbs, thus appearing brighter or whiter in the scan. Our body is mostly made up of elements carbon, hydrogen, oxygen and nitrogen. All these elements have an atomic number less than 10. Heavier elements with atomic number more than 20 like calcium, especially when present in a concentrated form, cast white shadows when exposed to X-rays. Bones show up bright white on X-rays because they are full of calcium. This in-depth conversation about CT scan is crucial. In previous videos, we already discussed that most gallstones have a high cholesterol content. Now, cholesterol contains carbon, hydrogen and oxygen. Only 10 to 20% of gallstones have enough calcium to show up bright on X-rays. Even though CT scans are more advanced than ultrasounds, they frequently fail to detect most gallstones. This is similar to the camera lens example above. Imagine giving you a large, fancy, expensive telephoto lens for indoor shots at home. It would be terrible. You can't capture even a single person's picture. Coming to some other weaknesses of CT scan. CT scan uses X-rays, which are a form of ionizing radiation. Repeated scans increase your chance of getting cancer, but it's a small risk. X-rays can't be used on pregnant women. The dye used in CT scan can cause allergic reactions and kidney issues. Let's come to the next scan, MRI. MRI's core principles depend on how protons in the body, particularly hydrogen protons, respond to magnetic fields. Because the human body contains so much water, which is H2O, hydrogen protons are everywhere within it. MRIs are really good at finding gallstones, particularly those that have migrated to the bile ducts. MRCP, a specialized MRI type, provides the clearest pictures of the biliary tree. MRCP makes water and fluids such as bile look really bright. Since gallstones are solid and dry, they show up as dark spots in the bright areas of the bile on scans. This difference is the main way to find gallstones. Research shows MRCP is just as good as ultrasound at finding gallstones, maybe even better, as high as 95% in some studies. However, there are some weaknesses of MRI as well. Some patients find the scan uncomfortable due to its noise, duration, and confined space. MRI uses very strong magnets. A 3 Tesla MRI has a magnet which is 60,000 times stronger than the Earth's magnetic field. MRI is dangerous if you have metal implants, example made from iron or common steel. These type of implants are usually not used nowadays. Typically, ultrasound is the first modality for initial diagnosis of gallstones. When gallstones are confirmed, and if there is suspicion of some complication associated with gallstones, CT and MRI are needed. Coming to the next scan, EUS, endoscopic ultrasound. EUS is a sophisticated medical imaging technique that combines two powerful diagnostic tools, endoscopy and ultrasound. In EUS, an ultrasound probe is mounted on an endoscopy apparatus. During the upper endoscopy procedure, the ultrasound probe tip is positioned very close to the target organ, in this case the gallbladder on the bile ducts, avoiding interference from the skin, fat, muscle, bowel gas or any bone. It provides high resolution images of the target organ. EUS is used for detecting small stones or sludge in the gallbladder or bile ducts, especially when other imaging like external ultrasound or MRCP is inconclusive. US is generally considered a safe procedure when performed by an experienced endoscopist. However, like any invasive medical procedure, it carries some risks, although serious complications are rare. It's interesting to note that the discovery of X-rays and the invention of CT and MRI scanners all earned Nobel Prizes. Yet, those who invented ultrasound scanners received no such award. One reason may be that the development of the medical ultrasound scanner was a long and collaborative process, building on discoveries in physics and engineering over centuries. So probably they could not pinpoint to a single person or a team. Other tests performed in selected patients: oral cholecystography, OCG, cholecystography, HIDA scan, bile microscopy. I will not elaborate on the specifics of these tests. Nowadays, these tests are not commonly conducted. Blood tests. Blood tests cannot diagnose gallstones. They only help in assessment of possible complications from gallstones. Let's recap what we have learned today. We don't see things as they are. We see them as we are. The phrase is applicable to medical scans too. They can only show what they are designed to see and miss obvious things in their blind spot. Failure to understand this can result in a series of errors. Some patients, when asked to mention the type of scan they underwent, they say all scans are done, totally ignorant about what scans are actually possible. Funny thing is, we can still be ignorant about the patient's actual problem after all the scans. In many gut disorders, the diagnosis hides in the patient's story, not in the radiologist's report. Robert Greene, an American lawyer and writer in the 1800s, said, "It's 1,000 times better to have common sense without education than to have education without common sense." For gallbladder stones, it all comes down to using good judgment and choosing the right tests. In the tests, abdominal ultrasound is the king. All other scans are king's allies. For more information, please watch our other videos in this series. Bye.